Weak disease surveillance mechanisms can have catastrophic effects for even basic conditions like diarrhea, which is the second highest cause of death in young children under 5 in the Pacific Island region. Therefore, it is important that healthcare facilities report particular symptoms they are seeing and that we are able to create a solid network for disease information. However, it's particularly difficult to do this in the Pacific region. Limited access to the internet and low rates of digital literacy inhibits the use of conventional communication systems like websites and apps. This makes it hard to track the spread of outbreaks of diseases between villages, health facilities, central health authorities, and regional bodies. There are 3 user groups with a stake in disease surveillance. Anele and Caperno have or had typhoid fever in the past. They're willing to contribute to syndromic surveillance if it's not much effort, so that their loved ones can get the treatment they need and even the knowledge to mitigate disease outbreaks. Laakia is a precious doctor in the Pacific with limited resources. We know there is a problem, so we need a solution. An accessible system that allows for effective disease surveillance, which enables communication between the patients and the medical professionals.
MediConnect is an integrated health management system which will enable open communication between central health organisations, doctors and individuals to effectively control disease outbreaks. Doctors can immediately notify the central health organisation of symptoms or diagnoses prevalent in their community. The health organisation will then be able to identify hotspots and relay appropriate health information to doctors and communities in real time. Additionally, individuals without immediate access to medical assistance can engage with the Central Health Organisation in a guided automated conversation where in plain language they will be asked to identify basic symptoms. The health organisation will then be able to provide basic health care and recommendations until they are able to visit their doctor. Furthermore, MediConnect enables medical personnel to collaborate with others, such as leading specialists, where through teamwork, significantly more patients can be correctly diagnosed and treated. Phase 3, facilitated by the low latency and high reliability characteristics of 5G, will enable health data from remote locations to be automatically recorded and shared with the Central Health Organisation. Doctors and individuals will no longer have to manually provide information. Artificial intelligence can also be used to accurately identify symptoms and diseases through photos or videos.
Similar platforms such as MTRAC have found past success in disease surveillance. Rapid SMS was used to obtain disease reports from health workers, village health teams, VHT, and a community. Furthermore, a district health team was employed to verify SMS reports and follow up in messaging on health facilities that were failing to report. This has led to quicker disease responses where it was found out to be halved, now averaging from 2 to 3 days. In 2015, health workers were also able to respond to a typhoid outbreak within hours of. With our solution, the authentication system prevents abusive data reporting system. The costs that come with printing and paper reports will be reduced. For stage 1, assuming clinicians have phones, additional materials are not required to implement the solution, and it can be easily scaled up through the stages. If the health professionals don't have SMS enabling device, they may be provided one which can be 40 to 75 AUD for lower mid-range smartphones, and even cheaper for traditional flip phones or brick phones. SMS and voice call plans start from around 10 AUD a month. Additional costs will be incurred during the implementation stage and throughout the process. The system will have to be introduced to professionals and they would have to be familiarized with how the system works. Monitoring roles will be needed to make sure everything is running smoothly and effectively. Using the existing infrastructure of mobile phones and cell towers on the Pacific Islands, minimal natural resources would be required as no new infrastructure will be needed for our system's implementation. In this way, we are able to maintain the preservation of Pacific Islands' natural resources. Furthermore, the system of disease surveillance allows for efficient resource management towards disease-prone. The benefits are definitely numerous and supported by the success of other countries who have adopted a similar system of disease surveillance. For one, MTRAC is a disease surveillance system that was found to be highly successful when implemented in Uganda, whereby the system had helped save $400,000 in misappropriated funds. It should also be mentioned that the system of disease surveillance relies on real-time updates, which is more efficient for its purpose as outbreaks can be acted upon more quickly. Using an SMS-based system will also reduce the need to excessively educate those on how to use MediConnect, as all mobile phones have this function. This will greatly reduce the time taken to use the system, as people would already be aware of how to navigate the SMS system, which will form a quicker reaction time to saving lives and preventing the spread of more outbreaks. Lastly, sending SMS relies on the phone network and not upon internet coverage, which means that it is able to evade cases of flaky lives. With MediConnect, we will be able to boost medical connectivity and ultimately aid in the health of all people in the Pacific Islands.